Hello friends, welcome back to our YouTube channel Doctorscorner. Today we are going to discuss about one clinical condition known as dequervaintenosynovitis. Okay, what exactly is this condition? What are the signs and symptoms of this? What is the treatment options and the pathophysiology we are going to discuss in this brief video today. So basically in this clinical condition there is pain and swelling of the radial aspect of the wrist, okay, just at the base of the thumb. So a patient will feel pain and there is a swelling. So why there will be pain and swelling, what are the causes and all we will discuss today, but briefly let us discuss the first history about this clinical condition. So this was first described by a Swiss surgeon by name Fritz de Quervain, okay, Fritz de Quervain in the year 1895. Okay, so on his name this condition is termed as dequervaint's tenosynovitis. Now let us discuss the etiology and the pathophysiology. Okay, so actually the exact cause of this dequervaint's tenosynovitis is unclear. So it has been attributed to the myxoid degeneration or the mucoid degeneration with fibrous tissue deposits and increased vascularity of the tendon sheets of the first dorsal compartments of the wrist. Okay, so let me describe you the pathophysiology. This is the first dorsal compartment of the wrist. So I will just label the tendons here. So this is the tendon of the muscle abductor pollicis longus. Similarly, there is one more tendon here. This is the tendon of extensor pollicis brevis. Okay, so this basically the function of this tendons is to abduct and extend the thumb. Okay, so basically they passes the first dorsal compartment. So in this clinical condition what happens, there is a sheath overlying these tendons. Okay, so I will mark it with the blue color. So this tendon sheath will become swollen. Okay, and there is a one thing known as extensor retinaculum, this which I am marking right now. Okay, so which covers this first dorsal compartment of the wrist. So this tendon sheath and the synovial lining will become thickened due to the friction or the continuous or the repeated use of this two particular tendons. Okay, so that may lead to this clinical condition. So this condition is seen in even the mothers of the newborns. So this is also known as mummy's thumb. So what is this mummy's thumb is, you can see as you can see in this diagram, the typical position of holding the newborn, okay, with the extension and abduction of the thumb. So and radial deviation. So this causes the friction and overstretching of this particular tendons. Okay, this is also known as Blackberry's thumb. Okay, and various names have been given. Blackberry, those who are using this continuously for playing the video games, okay, on the mobile phone, Blackberry, that was termed. Okay, there are other names as well. So basically the cause is not clear, but it is seen in this clinical persons who are even with the musicians. Okay, so what are the signs and symptoms of this, or what are the clinical features of this clinical condition? Clinical features. So basically the most important clinical and diagnostic feature is the patient will complain of the unilateral pain and tenderness or burning sensation or weakness of this radial side of the wrist. Okay, and because of this is not able to use this particular part of the hand properly. So what is the diagnosis? So clinically we can diagnose it with one provocative test known as Finn-Kjelstein's test. Finn-Kjelstein's tests. It is also known as modified Eichhoff test. modified Eichhoff's test. Okay. So, basically what is done in this particular test is, as you can see in this diagram, the patient is asked to make a fist with the thumb in the flex position, and the examiner will deviate the wrist towards the ulnar direction. Okay, with this red color I am drawing the direction of the movement of the wrist. So, whenever the examiner does this, then you can see there is a pain, severe pain or tenderness is seen on the radial aspect of the wrist, okay, near the stellate process. So, this test confirms, Finkelstein's test confirms the dequervaint's tenosynovitis. Okay. So, other conditions like osteoarthritis, even carpal tunnel syndrome and all may mimic this. So, if at all it is confirmed, then what is the treatment? So, generally it is a self limiting disease, so it will resolve by itself, or the treatment can be analgesics or painkillers like NSAIDs can be given, or injections of the corticosteroids. Corticosteroids are very much helpful. Corticosteroids, then physiotherapy, and even the splints can be given. Okay, this is a typical splint to immobilize the thumb. So, with this conservative treatment, majority of the patients will be treated, but in those which is not cured by the conservative treatment, then typical surgical aspect or the surgery is done. Basically what is done is the extensor retinaculum, which is covering the tendon sheath, is released. So, release of this extensor reticulum is done either partially or completely, depending upon the condition. Okay. So, this is all about the dequervaint's tenosynovitis. So, let us just summarize what we have discussed today. So, we have discussed about the etiology, pathophysiology, and the signs and symptoms of this clinical condition, dequervaint's tenosynovitis, and most important is this Finkelstein's test and the treatment of dequervaint's tenosynovitis. Hope you like our video. If so, please subscribe our channel and share the